Today is World Kidney Day, and it's a day that is set aside the world over for us to discuss how we can improve kidney health. And it happens to be the 20th, so we have been doing this for the past 20 years. And the idea is to ensure that people get to know about their kidneys and how well they can take care of their kidneys. As an organization, we kept educating people from the beginning of March. We've gone to radio stations. We had floats through the principal streets of Kumasi yesterday, and we ended up doing free screening for at two sites, the kids and then for adults. And today has been fantastic, where we've had a long discussion on kidney with very good questions asked, where we've educated people as to how they can prevent kidney cells. So if you are to ask me, I think it's been very successful.
Almost 14% of our population have kidney diseases, and two major conditions account for majority of kidney problems, especially in the adults: diabetes and hypertension. These conditions are preventable if we're able to bring hypertension and diabetes incidence low. Then these two conditions that account for majority of the chronic kidney diseases that we have now. Okay, if we reduce them, then the kidney problems from these diseases will also go down.
You know, without education, you cannot transmit information or give information to anybody. So I think that education is the driving factor for all this program that we have done. We brought in nursing students, pharmacy students, health workers, other non-health workers. We brought them here. We also told them about the day, the essence of the World Kidney Day, educating and telling them about the need for getting a healthy environment to be able to get a healthy kidney.
As stakeholders in the medical supply industry in Ghana and stakeholders with Konfanoti Teaching Hospital, where they have our dialysis machines, we saw it as a need to partner with them to create awareness about kidney health and then the early prevention, things that will be the measures that have to be taken in place to prevent kidney disease.
The program was very educative and I actually learned a lot. Like the risk factors that we have. Once you know the risk factors, or if you know that you have a family history of, let's say, chronic kidney disease, and then you come to the hospital, I would educate you on things or practices that you should do and what you should not do, which will not lead you to having or developing the chronic kidney disease.
One exciting thing I heard today is about the AMPO1 gene mutation that is linked to people with African origin, which makes them susceptible to kidney failure.
Gone are the days when some 3-4 years ago, every patient who gets kidney failure will pay everything out of pocket. But that is not the situation now. And guess what? The new government comes in with the Ghana Medical Trust Fund, and they have taken 3 or 4 key areas to sponsor, and yours truly, kidney health, is also involved. So there's a lot of hope so far as kidney care is concerned, and we believe that we have come far, but there's still a lot to be done.
This has opened my eyes to new and then greater things, and I pray that they continue to get their sponsorship so that as time goes on, bigger and bigger programs such as these could be organized for us.
To my colleagues, I'd like to say that when programs like this are actually happening, they should involve themselves more, since it's an avenue to learn more about the things that we sometimes take for granted.
So my wish for all is that everybody gets healthy kidneys. So kidney health for all.
Kidney health for all, caring for people, protecting the planet.